Medical interventions themselves are the third leading cause of death in the US and UK after cardiovascular conditions and cancer. Those well-meaning doctors in the white coats are actually making you sicker. It's known as iatrogenic risk. The data includes deaths from surgeries and procedures, but the highest numbers are from pharmaceutical drugs, mostly taken as prescribed. In one 2019 study of emergency room visits, it was found that there's 6 visits due to medication effects for every 1,000 people in the population. Now, if you extrapolate that rate to the whole of the US population, it indicates over 2 million people every year visit a hospital due to an adverse drug reaction. And the fact is, the majority of drugs don't actually work for most people. It's commonly known in the pharmaceutical and medical industries, but something that's not often shared with consumers. GlaxoSmithKline had a bit of an oops a few years ago when a senior executive spoke at a public meeting and said the vast majority of our drugs, more than 90%, only work in 30 or 50% of the people. Now, the goal of the meeting was to improve response rates, which is commendable, but think about that math for a minute. If we break it down by category of drug that treats some common ailments, so for example, Alzheimer's only works in 1 out of every 3 patients. That's 30% effective. Arthritis drugs, 1 out of every 2 patients, 50% effective. Autoimmune, 1 out of every 2, 50%. Cancer drugs, only 1 out of every 4 patients responds to the cancer drugs. That's 25% effective. Migraines, 1 out of every 2 patients, 50%. Osteoporosis, 1 out of 2. Diabetes, 1 out of every 2 patients, 50% effective. So you've got a 50-50 shot at best of a particular medication working for you. Now, you may be in the positive group, or more typically, your doctor will just switch you to a different drug with a different kind of a profile to see if that works any better. And that may be an acceptable path if by not working, the drug is not really doing anything in your body. But unfortunately, that's not the case. Every drug is doing something in your body. It may be doing what it was designed to do, or it may be something called a side effect. But that is really kind of playing down what's actually happening. So the pharmaceutical drug is designed to address a particular symptom or pathway in the body. So let's say a headache, and the pathway is registering pain. But your perfectly designed human body is going to work around that pathway block and find another way to keep you functioning. And that's where the problem lies. That workaround leads to unintended consequences and puts more strain on your body, leading to what we call those side effects. So then your doctor may typically suggest another medication to combat the side effects of the first, and that leads to more side effects, and so it goes. Until you find yourself on multiple medications and the underlying cause of the original symptom was never actually addressed. Now, from an employer perspective, you're covering the drug in the health plan, but you're not actually helping the employee achieve health. Your drug spend is going up year after year, and your employees are actually getting sicker. In later videos, we're going to look at specific drugs and specific conditions and what the get-off pharma model looks like in practice. Hope to see you there.